Everyone for joining us for our weekly media briefing. We apologize for the delay. We had some audio difficulties, and we know that you want to be able to hear everyone who's here. So we think we've got that resolved. I'm Kerri Schuette, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start with the numbers. In Shasta County, we have 572 confirmed cases, including 2 from Monday. We had 195 negative tests on Monday. We've got 2 people in the hospital, including 1 who is in the intensive care unit. We have 17 people in isolation. Those are people who have tested positive. And we have another 108 in quarantine, and those are people who have been close contacts of those who have tested positive. We have had 12 deaths as of Monday. Today with us, we have Donnell Ewert, the Director of the Health and Human Services Agency, Dr. Karen Ramstrom, who is our Shasta County Health Officer, and Matt Pontes, the CEO of Shasta County. We also have Glenn Hayward from the Redding Rancheria, along with our media folks. Do any of you have any words to start us out with before we go to media questions?
So good morning, everybody. So I had some information to share based on some questions we have received from the public recently. Is this a good time for that, Kerri, or do you want to come back to that? Good?
Yep, that sounds great.
Okay, great. So I just thought this might be interesting to all of you as well. So I'm just going to go through a few questions and provide some brief answers, and we'll be providing this later in more detail in writing. So the first question was, what are the false positive and negative rates on tests used to claim COVID cases in the county? So there's 2 FDA-approved types of tests for diagnosing COVID-19, the molecular and antigen tests. The antigen tests are still coming along, and so I'm not going to focus on that today, but we can provide more information at a later date. That's not really widely available yet. The molecular tests include what you probably mostly hear about, the reverse transcriptase polymerase chain reaction, or PCR test we call it, and that's a very specific test. And that's what's most commonly used by the labs that are processing specimens for Shasta County residents. And as far as reliability, the information from the FDA on those tests indicate 100% positive agreement with positive controls and 100% negative agreement with negative controls, which just means that the likelihood of false positives is very, very low. We worry more about false negatives, and that typically has to do with the specimen collection technique and the timing of infection. So people are more likely to have those particles of the viral RNA in their nasal passages or in their throat passages earlier in infection. In the literature, some studies have shown that the false negative rate can be as high as 30%. So again, making sure that we have really good specimen collection is important. And then also the other piece is that when we have symptomatic individuals, especially if they have a high likelihood of infection because they've been around somebody who's been confirmed, even if their test is negative and it sounds pretty much like COVID, we like to recommend that they isolate even if their test is negative. The second question was, how many of the positive cases are due to multiple positive tests of a single individual? And the answer to that is 0. We review all of our reported cases, and at this point we have the capacity, and all through this outbreak have had the capacity to talk to every individual that is reported to us. So those are all counted only one time, as we shared before. And the second part of this question had to do with the total number of tests. So the current number of our reported total tests can actually include an individual with more than one test. There used to be a testing strategy to release from isolation that's no longer recommended. But the total number of unique individuals with negative tests right now are a little over 21,000 of our 35,000 tests. But again, we only count cases one time, and we interview all of those individuals. The third question was, how many deaths from COVID occur versus those with COVID? So how many die from COVID versus with COVID? And so all of the individuals that are reported in Shasta County have died COVID, that's actually attested to by the reporting physician, the attending physician, or the coroner. We haven't had any coroner cases here, but the physician who actually took care of the patient, who noticed the course of their illness, reports that information and takes that very, very seriously. They take into account the testing that's been done, the medical records, the medical history, the course of care. And that information is specified very specifically in a very, I should say, in a very specific manner on a death certificate. The initial part of the death certificate actually records the sequence of events that led to the death, with the underlying cause of death in this situation, often being COVID. There's also a part 2 on the death certificate that provides an opportunity for the physician to list other significant conditions that could have contributed to the death. And I think because of these 2 parts of the death certificate and cause confusion, there was a recent report and misunderstanding of the way CDC reports this information. So individuals can actually have underlying health conditions that contribute to the severity of illness or their likelihood to acquire infection or recover. So those conditions can be listed on the death certificate because they contributed to the individual dying. And there can also be medical conditions that are listed that are part of the course of the pathophysiology of the illness. It's a systemic illness and can contribute to the death. The next question was how many hospitalizations were or are from COVID as opposed to with COVID. And so this, we have individuals in touch with our hospitals every day. So we're well aware of what's happening in the hospitals. So hospitalizations counted if a patient's admitted for COVID-19 and they're on transmission-based precautions or they're isolated in the hospital, and that's determined by the CDC guidance as well as our infectious disease physicians in the community. If they're removed from transmission-based precautions or removed from isolation in the hospital and they're not ready for discharge due to severity or illness, they're still counted because they're still being cared for COVID-19 illness. If a patient's admitted for non-COVID reasons and they happen to test positive, they are counted as COVID initially because they're isolated. That takes up resources in the hospital, extra staffing, extra PPE, an isolation room. If during the course of their care, they actually develop COVID-19 related issues, they continue to be counted as COVID-19. And then lastly, there's a question about the death rate and calculation of the death rate in Shasta County. As I've shared, due to the small size of Shasta County's population and our number of deaths, there's not enough data to reliably calculate our local death rate. However, this has been calculated at the national level, and as I've shared previously, national figures indicate that COVID-19 appears to be likely to be the 3rd leading cause of death. Based on the most recent national numbers. So it takes a while to actually finalize those causes of death. And so the most recent statistics are 2017. So assuming that the same number of deaths from heart disease and cancer and accidents occur in 2020 as they did in 2017, it looks like COVID-19 would be the 3rd leading cause of death. So all of that information will be provided in writing later today or tomorrow. I'm happy to take any questions.
Thank you, Dr. Ramstrom. Did anybody else have anything to share before we open for media questions? Donnell.
Yes, I'm sure everyone's aware there's been quite a few changes in the way the state's categorizing counties as far as incidence goes, and how the stay-at-home order applies to each county. We have some nifty new pages on our website, shastaready.org, that explains this. If you go onto the Roadmap to Recovery tab on that website, you can see the different tiers and what is open in the different sectors. And we are in the orange tier 3, which allows opening of many of the sectors that were previously closed between around July 13th and the 31st of August. In addition, we have a page on the site under data and statistics that shows the map of California with the counties and what tier they're on. And it also shows the case rate for Shasta County with the background of the tiers, and also the testing positivity rate in Shasta County with the background of the tiers. So you can see which tier we've been in ever since the beginning of the pandemic, even though those tiers weren't in effect until the 31st of August. So, you know, I think the good news is there are only three counties that are in the yellow tier, or tier 4, which is the most open. And those are Modoc, Alpine, and Tuolumne, 3 very small counties. There are 8 counties in the orange tier, which we are in, and we are the largest of those counties. So we are the largest county in California that is in yellow or orange. So I think, again, that's a testimony to the fine work that our incident command and our Dr. Ramstrom have done to keep incidents under control in Shasta County.
All right, thank you, Donnell. Anything else? No? Okay, we are ready for media questions.
I got a quick one. The definition of capacity for a restaurant, 50% capacity, would the benchmark be their usual seating, or would it be like the fire marshal maximum capacity?
Right, thank you for that question. So that has actually been in discussion since the guidance came out, and sort of just initiated a conversation with some of our environmental health partners too. And I think, you know, it's still sort of in development how that can actually be implemented in a way that's that specific. And so the underlying principle is 25 or 50% of their normal occupancy. But there is some discussion about the fire marshal numbers, though, concerned that that would actually allow more than they would normally have in their business. So sort of still in the works, but at this point, you know, I think that we rely on restaurants, for example, to look at their normal occupancy and gauge it from that.
So off that a little bit, restaurants can now be open with restrictions. We can have gatherings of up to 200 people if the venue is large enough, but why can't we have lunch meetings?
So gatherings are not allowed, the sectors that are open in a very specific way are have modifications in place based on that particular type of activity. And so I guess if you were in an office space, there's certainly guidance about how you would have meetings and wanting to be physically distanced and implementing all of those recommendations as are in the guidance. But gatherings in general are not allowed.
Okay, it's like specifically places of worship and things like that where people can come in, not like for a meeting. I got you.
Right, they're based on its specific sector guidance that sort of outlines based on that type of a sector, that type of a venue, how those prevention practices should be implemented based on that particular sector.
So for either
the general sense of that question is, if you can do something in one place, why can't you do it in another? And I think with the places of worship and outdoor protests, those are protected by the First Amendment, so they are a little exceptional. And then the movie theaters, people are not speaking; they're all facing one direction and they're not speaking. So that's different than, say, a party where people are interacting quite a bit, laughing, talking, hugging. So I think there is quite a bit of a difference, and we definitely need to maintain our discipline on not gathering, because we have seen incidents come down in the last few weeks due to some of the dimmer switch and mask mandate that the governor implemented. But now that we've got the businesses open again, we want to keep them open, and we all need to be disciplined about not gathering in our homes and other places with a lot of people.
You know,
Thank
and
you.
I would just add to that, thank you, Donnell. I would just add that we definitely have seen instances of transmission in more social settings, even among family members, where they feel like they'd be in a safe situation, just gathering informally like they normally would. And this virus is infectious and can travel even in those kinds of more informal settings where you would just normally be getting together with family outside of your household. So that's why that continues to not be recommended.
Thank you. What is the secret sauce of Shasta County? Everything working together, I guess, but we see, like a place like Butte County that's what, 4 or 5 times and roughly the same population as Shasta. What is being done here that's been, so successful?
Well, I'll tell you, we're holding our breath every day. It's an interesting question. I think that the one thing I can share is that early on in the pandemic, we did a lot of proactive work with some of our higher risk settings, and I would hope to think that paid off, and that many of those settings are prepared and have been prepared. So when they've actually had a case here and there, they've been able to contain it and prevent it from spreading. I'm sure that our demographic and geography and all of that contributes. And I think the concern and the behaviors of our residents, people are taking the recommendations seriously in most instances, and being careful about who they're around and mask wearing, and then probably a little bit of luck thrown in, I'm guessing. But I think time will tell, of what's really making a difference. I think it's an interesting question.
Thank you.
Other media questions? All right, if you've got nothing, then we will wrap it up. Unless anybody else has anything to add before we.
I just wanted to clarify what you're saying, because it's a really good, it's a question that was on my list too. So just to clarify, meetings are still not allowed because the logistics of having meetings puts people in situations where they cannot basically follow the restrictions the same way that restaurants and movie theaters can just logistically do, correct? I just want to make sure I've got that right.
I think in a restaurant, you have parties coming in. Generally, they're going to be people that know one another. Sometimes they're going to be in the same household, sometimes they're not, but they're going to stay at their table. Their exposure to others is very limited to their server. The server is masked, and hopefully those individuals in the restaurant are masked until they sit down. So, and they also stay for a limited time and then leave. If you have a gathering, like a fundraiser or a party, like a birthday party or a wedding party, generally those go for 3-4 hours, maybe longer. You've got a lot of moving around, people interacting, and having prolonged exposure to one another, and that's that's what gets problematic. And people might also drink alcohol and become less disciplined in social distancing and wearing their masks. So those are all concerns, and it is all a matter of risk. And we especially want to try to keep our business activity going, our economic activity. We want to protect our businesses and jobs first and foremost, so we don't have such dire impacts on the population from that standpoint. And just put off our social gatherings a bit longer until we have that vaccine.
Thank you.
I think hopefully that page on Shasta Ready, the Roadmap to Recovery link page, helps people see what things would not be open if we were to move into that red level. And there are really a lot of things that are able to be open now with modifications. So it made a big difference that the community pitched in, and it has helped us keep those case numbers and our case numbers low and our positivity rate within a good range to keep us in that orange level. Any other questions or comments? All right, thank you everyone for being here with us today. We will see you again next Wednesday at 11 a.m. Have a safe and healthy week.